So it'll say recording on your end. So tonight we're going to be doing chapters 4, 5, and 6. Any questions from chapters 1, 2, and 3 that you guys have? Feeling good about those? This is the first like 9 chapters or so are pretty like basic stuff. So when we dive in deeper with all of this stuff again in the chapters coming up. So what we'll do tonight is 4, 5, and 6. 4 is medical terminology. 5 is anatomy and physiology, and 6 is lifespan development. I'll stop after each chapter and we'll chat. I'll see if you guys have questions about it. We'll take a little quick break. I'll pause the video. And then if you guys do have questions, you can throw them up in the chat as well, and I'll try to answer those when we're on a break, or you can just ask me when we're done with each chapter, or you can interrupt me if you need to at any point as well, and I can answer questions too. So we'll kind of slowly work through this. These chapters aren't super long, so I don't think we're going to be here for 3 hours tonight. Probably be an hour, hour and a half or so. So prepare yourselves for that. As we go into the bigger chapters coming up, obviously we'll be doing a little bit longer, but we'll just slowly go through. When we get through, we'll be done. So, all right, I'm going to share my screen with you guys. We're going to start with chapter 4. All right, so you guys can see, hopefully, you can see that PowerPoint on there. I kind of like leaving the instructor preparation on the bottom because it's some of the stuff that I'm reading. I'm going to downsize this so we're not seeing our faces on here while we're recording because that's just awkward. So chapter 4 is medical terminology. The topics of this one are going to be the medical terminology, obviously, and then body regions and cavities. So when we talk about medical terminology, it's just medical language. There's a lot of words we put together, and we've all had, like English class and that type of stuff. This is kind of that chapter. I feel like I'm an English instructor. So we'll start with the medical terminology point of this. So using some of the precise anatomical terms makes our descriptions a little bit more precise. And a lot of this stuff is universal with EMR, EMT, and that kind of language. So it's not something that we need to hyper focus on. Like this medical terminology stuff is like, I want you to know some of it, the basics of it, but don't get so hung up that you're not actually doing your patient care and you're trying to come up with these terms. So terms like cardiologist. So cardio is the heart. Ology is the study of, like biology is the study of life. ist is one who specializes in something. So a cardiologist is going to be one who specializes in the study of the heart. Each of these have a root word. They have a prefix. These are things that are connected to the front. That would be an example of cardio. They have a suffix, which is connected at the end of the root word, which is the ology or the ist. And these are usually connected with some kind of vowel, an O or an I or something like that. So some of the common ones that we use in this field, we have cardio, which is a root word meaning heart. We have neuro. This is a root word meaning nerve, like neurology. Nasal, this is going to come into play when we talk about airways. We have a nasopharyngeal airway or a nasal airway. That's a root word for nose or nasal. We have oral. Again, it's a type of airway that we use, so called an oropharyngeal airway, oral airway, and that has to do with the mouth or oral. There's hyper. A lot of people get these mixed up. Hyper and tachy, they'll get them mixed up with rapid or high. So hyper is a prefix. This means high, above normal. So hyperglycemia, hypertension would be examples of that. Hypo is below normal or low. Hypothermia, hypoglycemia, low blood sugar, low body temperature. So hypo. Tachy is above normal, but means rapid. So it's very similar to hyper. That just means high. Tachy means rapid. This would be like your heart rate is tachycardic. So you have a fast heart rate or a rapid heart rate. You have Brady, which is below normal, also known as slow. So again, bradycardic. This would be a slow heart rate. The suffixes that we use, AC, this would be pertaining to. Ology is the study of. AL is also pertaining to. And IST is one who specializes in something. So those are some of the common ones that we use. Anatomical terms, this is the anatomical position, the standard position we use when we're referring to a patient. They're standing, facing forward, legs shoulder width apart, arms at the sides, palms turned forward. When you refer to the right and left, keep in mind that that's your patient's right and your patient's left, not our left and right looking at them. It's actually their right and their left. So this is some of the reference points for the anatomical stuff, and we'll talk more about these coming up as well. But right and left. So up on your head area, you have your cranium, your face, your mandible, and your neck. Mandible is your jawbone. Your torso, you have your thorax, which is your chest cavity, your abdominal cavity. Your pelvis is kind of right in the middle. You have your extremities, upper and lower extremities. So for upper extremities, you have your shoulder, your arm, elbow, forearm, wrist, and hand. And then your lower extremities, you have your thigh, your knee, your leg, ankle, and foot. Supine is a body position that means lying on your back facing up. So anybody just lying on their back facing up, if we want to use the correct terminology, we would say that they're in the supine position. Prone is the opposite, lying face down on their stomach. So if they're in this position, they are what's called the prone position. We have recovery positions. We have the right lateral recumbent and left lateral recumbent, which would be the next slide. This is the patient lying on their side. We also refer to this as the recovery position. So if we have somebody that has had a seizure and they're postictal, we can roll them on their side, which is right lateral or left lateral, also known as a recovery position. So she's lying on her right side, patient's right side, and this one, she is laying on her left side. Again, anatomical positions. All right, medial and lateral. So medial, picture yourself, and you're going to cut yourself in half this lengthwise, this way, how my mouse is going. This is called your midline. When it comes to medial, medial means closer towards your midline. Lateral is meaning away from your midline. Midclavicular, those are just at your collarbones. And then we'll talk more about proximal and distal. Proximal and distal coming up, but proximal is more towards the point of attachment, like your shoulder, and distal is why we say it's distal pulses. Distal is meaning away from the point of attachment, further away. If you turn yourself and cut yourself in half this way, this is called your mid-axillary line. Anything towards your head is called superior. Anything towards your feet is called inferior, because your head is more important, right? It's more superior. Your front is called your anterior or your ventral. Your back is called your posterior or your dorsal. Think of like a dorsal fin on a fish. Posterior. So your mid-axillary line, superior is anything towards the head, inferior is towards your feet, anterior is towards your front, posterior is towards your back. This is our distal and proximal again. Again, distal is further from the point of attachment. Proximal is closer to the point of attachment. We usually use these with extremities. Example of distal would be the wrist. Your wrist right here is distal to the elbow. It's further away from the point of attachment, which is your shoulder area. Proximal, the elbow would be proximal to the wrist because it's above it. is closer to the point of attachment right here. And again, medial, that's our towards the midline, lateral, away from the midline. Dorsal is our feet down here, and this is the patient's anatomical position. So this is the patient's left foot, and this is the patient's right foot. Left side, right side. And there's our anterior ventral and posterior dorsal. So anterior is towards your front, posterior is towards your back. Some directional terms, we have superficial. This is towards the surface. So like a scrape would be superficial. Deep is farther from the surface. A cut that exposes muscle tissue is deep. Some of these terms will come in later when we talk about lacerations and avulsions and stuff like that, frostbite. Internal is anything inside your body. Like internal bleeding would be bleeding you can't see, which is inside your body. External is outside of your body. So if external bleeding is bleeding that we could see. For body regions and cavities, we're going to start with our cranial cavity. We have a thoracic cavity. We have our diaphragm, which is that muscle. And then our abdominal pelvic cavity that we'll talk about. So just kind of understanding some of the body positions, directional terms, understanding some of the body regions, the topography, and what the body cavities all have in them kind of helps with our patient assessment and management of our patients. So let's start with the top one, which is the cranial cavity, which holds our brain. That's what that holds. That's kind of an important thing. Our thoracic cavity, this is our chest cavity. So this is going to be our heart, our lungs, our great vessels like your aorta, your bigger veins, and your esophagus. So cranial cavity is the brain, thoracic cavity is this pink area right in here with the heart, lungs, the great vessels, and the esophagus. We go into the abdominal area, and people are always like, man, there's a lot of stuff just packed in here, right? So our abdominal cavity, it contains a lot of stuff, but we're going to call it 4 different quadrants. So we have our right upper quadrant with this, which is this quadrant right here. The middle of this, our 4 quadrants of our abdominal area is our belly button, okay? So our right upper quadrant, we have our liver, the right kidney, a colon, pancreas, and gallbladder. And you'll see that a lot of this stuff is the same on each side, okay? Our left upper quadrant, liver, same as over here. Our spleen is there. Our left kidney, we also have a kidney over here, colon over here, colon's over here. Our stomach is partly up into here, and pancreas, which is over here as well. So really big major differences is your gallbladder up in this area and your spleen and part of your stomach over in this area, and the rest is kind of the same. So right upper quadrant, left upper quadrant. We have right lower quadrant. This is going to be the colon. This is on both sides. Colon, colon, small intestine, your major artery and vein to your right leg. That's your femoral artery and vein coming down right here on each side. On this side, so in the uterer is on both sides. So they're all the same. The only difference between the right lower quadrant and left lower quadrant is that little pesky appendix that's in there that people have problems with. And then in the middle, we have our aorta, our pancreas, small intestines, bladder, and spine. So it seems like a whole lot going on in here, but things that people have problems with that we'll get, we'll eventually get to down the road. Gallbladder issues up in this area. Maybe they lacerated their spleen up in this area. Appendix down in this area. So there's things and there's structures underneath that if we know where some of this stuff is, we can do a little bit better patient assessment and care. And then we have our pelvic cavity. Abdomen is the blue that we talked about, and then we have our pelvic cavity down here. So in there we have the bladder, our rectum, and then for females we have the internal female reproductive organs happening down in that area. So for these, Prefix that means above normal, again, is hyper. Could also be tachy, that just means fast. That means high. If your patient has a minor cut on the right forearm, when describing the location of the injury, we would say that it is distal to the elbow. So if they have a cut on their forearm, it's distal to the elbow because it's further away from the attachment point, which is the shoulder. And then when compared to the bladder, the heart is superior. Again, superior meaning towards the head, inferior meaning more towards your feet, medial meaning away from your mid or towards your midline, and lateral meaning away from your midline. Okay, so that was the last slide on that chapter. They're all pretty basic going into this. All right, any questions so far? Am I going slow enough for you guys when I'm doing this? I'm posting this too, so you'll be able to watch all of these as well. So, okay. Do we need to take a quick 5 or are you guys good to keep going? All right, let's do it. So let me share again. Good to go, says Kevin. Awesome. I'm going to share chapter 5. All right. So this is anatomy and physiology. So some of the stuff we just talked about, we're going to go over again. Surprise, surprise. So the human body and the life support chain is what we'll talk about in this chapter. So a little intro. As a first responder, or EMR, just having, again, that basic understanding of anatomy and physiology is going to help us better understand how things are affecting our patient, the illnesses, the injuries, how we can provide good, appropriate emergency care and communicate clearly with who we're handing these patients off to. So anatomy and physiology is going to provide all of this stuff, better understanding, better care, and clearer communication in the long run. So when it comes to the human body, there's all these fun pictures on here. But the musculoskeletal system, this is the muscle system right here. And this one is a lot of big fancy terms, right? As a first responder, we don't need to know exactly like this is the deltoid, this is the tricep. We have a general idea of where some of these bigger muscles are. We have the bicep. Our obliques are in the outside area right here. We have our rectus abdominis, which is our abdominal area. So with these, I'm going to go bring this up a little bit. Just the study of the anatomy and physiology is kind of the first step towards understanding the structure and the function of our body. So understanding the structure and function of some of the organs that are in our body, the larger body systems, all kind of lead to us understanding how our body works overall. So we're going to review some of these major body systems. So anatomy, this is the study of structure and can be divided into 3 general types. We have topographic anatomy. This is the external surfaces and the shape of the body given by our underlying structures like our bones. We have gross anatomy. This is structures that are visible to the naked eye that are within the body, like our muscles, our bones, our organs, things that we can see. We know are underneath there. And then we have microscopic anatomy, which, just like it says, these are things you can see through a microscope, like our blood and tissue cells. So those are the 4 type or the 3 types of general types of the study of the structure. Physiology, this is the study of the function or how our body works. So the purpose of physiology is for the body to maintain a state of normal working order or homeostasis when all the body systems are working in balance with each other. So they are interrelated, and having that good general knowledge of the structure of the body is going to lead us to what these parts of the body do as well. So we have our skeletal system. So the book always says, just as buildings has studs and trusses to support it and give it shape, our body's skeletal system provides that support for us. So the skeletal system also provides protection to our internal organs, our rib cages, our cranium, all those bone structures protect what's underneath it. Bones of the skeleton consist of living and non-living materials. The living tissue has a blood and nerve supply, and the non-living materials doesn't. Bone marrow, that's located inside the bone. That is what's producing our red blood cells for the body. Us as adults, we have 206 bones in our body. Pediatric skeletons have fewer bones because some of them aren't formed yet. Bones have to be strong enough to support the body and protect our organs. They have to be flexible enough to respond to stress and pressure. And some of them are jointed to allow for movement. And we'll talk about what some of those are as well. Bones are connected to one another by ligaments. So bone, ligament, bone. So with the skeletal system, we have our skull, our spinal cord, thorax, which again is our chest cavity. We have our pelvic girdle. That's our hip area. Shoulder girdle, so our shoulder blades. And then our upper and lower extremities. So in the skull, this consists of a lot of bones. The cranium is consisting of fused bones. So when we're born, they're not totally fused. That's where those fontanelles come from. So before they're formed in what's called suture lines, we have that anterior and posterior fontanelle. The face consists of several bones that are fused together to form our eye sockets, our nasal cavity, cheeks, and upper jaw. And the lower jaw is the only one that's separated in the bone, and that's called our mandible. The spinal column, this consists of 33 total vertebrae. It's divided into 5 sections. So cervical spine, or also known as what's called a C-spine, is in your neck. So it starts at the base of the back of your head, and this is going to go all the way down. So 7 in there. So these would be classified as like C1, C2, C3, all the way to 7. You have your thoracic spine, which is going to be in your backside of your chest cavity, right in here. You have your lumbar spine. This is going to be kind of your lower back area, like the lumbar support. You have your sacrum, which are 5 fused bones that form the posterior or backside of your pelvic girdle. So this is like your hip area. It forms the backside of those, and those are fused together. And then you have your coccyx, which are 4 fused bones, also known as your tailbone, and that just hurts to fall on. So that is our skeletal system when it comes to the spinal column. We'll be talking more about that, obviously, when we get to like trauma and doing C-collars and that type of stuff. In our thorax, so again, our chest cavity, we have our rib cage is in there. There's 12 pairs of ribs, 10 pairs that are attached directly to the sternum or the breastbone. The 2 pairs of ribs that are attached to the spinal column but not to the sternum are called floating ribs. The xiphoid process, this is that little pointy tip at the bottom of your sternum. It's a piece of cartilage that's located down there. Your pelvic girdle, also called your pelvis. This consists of 3 bones called the ilium, the ischium, and the pubis. The iliac crest, this is the superior portion of your ilium or the wings of your hips. So it's going to be these wings up here on each side. That's a lot of times what people will break with their slip, tripping, and falling. You have your ischium. This forms the loops, the 2 loops on the inferior of the pelvis right in here. And then you have your pubis, which is the anterior portion of your pelvis or the front part of your pelvis area. The pelvic girdle is the point of attachment of your lower extremities. So this is where your femoral head is going to go in, right down here. And sometimes that's the part people break as well when they fall. So that's your pelvic girdle. Your shoulder girdle, this consists of your clavicle, which is your collarbone, and your scapula, which is on your back and posterior, called your shoulder blade. The shoulder girdle, that's the point of attachment for our upper extremities. The shoulder girdle allows for that circular movement of our upper extremities. So clavicle, collarbones, and scapula, again, is our shoulder blade. For upper extremities, we have the upper arm bone. This is called the humerus, and this extends from the shoulder girdle down to the elbow right here. We have our elbow, which is a joint that is formed by the distal end of our humerus. So distal meaning further from the point of attachment. And the proximal end of the radius, which is our next bone coming down. So our elbow. We have our lower arm. This consists of two bones in here, the radius and the ulna. The radius is on the thumb side, or the lateral side of the arm, and our ulna is on the medial side of the arm. The radius and ulna extend from the elbow to the wrist. We have our wrist. This is a joint that is formed by the distal ends of our radius and ulna bones to the hand. And then we have our hand, which consists of carpals. And as the bones get smaller, it goes metacarpal bones, and then your finger bones are called phalanges. We have our lower extremities. So we have our femur, also called our thigh bone, and this is the large bone of the upper leg. It joins at the pelvic girdle right here, at the proximal end, and extends down to the knee. We have our knee, which is a joint that's formed by the distal end of the femur and the tibia, which is this bone right here. The knee is protected by our patella, or our little kneecap right here. The tib and fib, so you have your tibia and your fibula. Tibia is our shin bone. Fibula is our smaller bone. So these bones extend from the knee to the ankle. Our ankle is a joint at the distal end of the tibia and fibula and the bones of our foot, which are very similar to the bones of the hand. We have but these are called tarsals, metatarsals instead of carpals, and then our toe bones are the same as our finger bones, called phalanges. You guys are probably thinking, if you guys watch Friends, there's no phalanges. Phoebe's yelling, there's no phalanges on the plane. So that's where they get that from. Their finger bones and our toe bones. All right, we have joints. So a joint is where two or more bones meet. Joints allow for movement of bones and have three categories. We have immovable joints, slightly movable joints, and freely movable joints. So immovable joints, these are the bones of this type of the joint that are fused. So this would be like our skull and our sacrum, that backside of our pelvis. They're fused together, so they don't move at all. We have slightly movable. So these are bones of these joints that are allowed for limited movement. This would be like our vertebrae going up our spine. And then we have freely movable. Bones of this type of joint allow for great range of motion. And there's a few different types of movements allowed. So we have hinge joints. This would be like your knee, your elbow, your fingers, and your toes. We have ball and socket joints. This would be your hip and your shoulder. A lot of times that's where you get like the dislocations. They pop in and out. You have your gliding joints. Those are going to be your wrists and your ankles. And then your saddle joint that we have would be our thumb. So that is our skeletal system. Our muscular system. This works in conjunction with the skeletal system to provide support and movement of the body. Tendons attach the muscle to bone. The ligaments are bone to bone. Tendons are muscle to bone. So these two systems are interdependent and often are referred to as the musculoskeletal system. There are 600 muscles in our body, and each one has its own purpose. Most muscles work in pairs. One muscle contracts, the opposing muscle relaxes. They're made up of bundles of fibers, kind of bundled together with an insulated cover. There's a nerve that's attached to each muscle, and that causes the muscle to contract when we stimulate it. There's three major types of muscles out there. We have skeletal muscles, cardiac muscles, and smooth muscles. The voluntary muscles, also called striated, or these skeletal muscles right in here, these are usually under voluntary control. They're attached to bones, and when we contract, it provides movement. Our brain sends an impulse through the nervous system that stimulates that nerve in that muscle, and that causes it to contract. We have our cardiac muscles, which I'm guessing you guys are already realizing that these are in our heart. They have special properties that allow it to generate its own stimulation in order to contract. So this is part of where the energy comes from for our heart. It's like for the contraction. And then we have our smooth muscles. These are called involuntary muscles, and these are usually part of like the airway systems, upper airway, respiratory system, the digestive tract, and some blood vessels. So that type of muscle is stimulated to contract without our conscious thought about it. It just does it. It's involuntary. It does it on its own. We have our respiratory system. And we'll talk about airways eventually here, but like upper airway is nose, mouth, this area right here, up to about the trachea line. This is going to be considered respiratory system or our lower airway. So with this, we have our trachea, which goes down straight through here. Right in here is our voice box. The apex of the lung is actually the top of the lung right here. So this trachea is going to go down. See how it goes straight down and then it branches off right here and right here. That's called the carina, where it branches off right in there. You have your two lungs. Your right lung has three lobes in it: right upper, right middle, and right lower. Your left lung only has two lobes because your heart is kind of tucked up inside of there. So you have your left upper lobe and you have your left lower lobe. There's no middle one like there is over here. You have your heart, which is tucked up into here. Your base of the lung, which is your bottom of your lung. And then your diaphragm is that muscle that's right in here. That's contracting and expanding when we're breathing. So respiration, this is the process of air entering and exiting the lungs, and the exchange of oxygen and carbon dioxide in the blood is called respiration. Inspiration or inhalation occurs when air enters our body. We go, take that big deep breath in, that's inspiration. When we let that air out or we exhale that air, that's when air leaves our body. One cycle of this inspiration, expiration, this is counted as one respiration. And the adult resting respiratory rate is, we take it in minutes. So we usually are breathing about 12 to 20 times per minute doing that. The pharynx, this lies posterior to the oral cavity. The larynx, this is at the superior end of our trachea, or the top end of our trachea. This is also commonly known as our voice box. So the larynx, again, that's our voice box. The trachea, this is commonly called our windpipe. It consists of C-shaped cartilage rings that keep it open, and you can feel those in your neck. You can kind of move them around a little bit. And then you have your bronchi. Those branch off of the trachea to form a right and left branch. Each of those branches get in smaller airways called bronchioles. They get smaller as they go down. At the end of the bronchioles, we have what's called alveoli. And these are those little tiny air sacs that are located at the most distal end, so the furthest end of our respiratory system. And this is where that oxygen and carbon dioxide exchange is going to take place. And then we have our diaphragm, which is that muscle I was talking about. It's that major muscle of respirations. It separates the thoracic cavity, again, with our abdominal cavity. So chest cavity and abdominal cavity. And it moves air in and moves air out of the lungs by contracting and changing air pressure in the lungs. If you've ever been like knocked down and had the wind knocked out of you, that's your diaphragm that's being affected. That's why it's so hard to get that breath in and out. You're like trying to, catch your breath a little bit. It's your diaphragm that was impacted by that. We have our cardiovascular system. And again, remember, we'll be talking about each one of these too, because we'll be going through respiratory emergencies and cardiac emergencies. So this is just a really brief overview of all these systems. And then we're going to dive more in depth with each one of these when we get into some of these other chapters. So the cardiovascular system consists of your heart and your vessels of the body. The blood vessels carry blood from the heart to all the tissues of the body where oxygen is delivered and carbon dioxide is picked up. Blood then runs back to the heart and lungs, where that carbon dioxide is eliminated and oxygen is picked up through respiration, us breathing that oxygen in. The blood also carries components to help fight off infection and produce clotting. Our heart consists of two superior chambers. So on top, we have two inferior chambers. So our top chambers are called atrias. We have a left and a right atria. And we have two bottom chambers, which are also called ventricles. We have our right ventricle and our left ventricle. So we have like this up here would be our right atria. This would be our left atria. Down here would be our right ventricle. And this big muscle right over here is our workhorse. That's our left ventricle right here. The heart works as the right side of the heart receives blood. Over here, our right side of the heart receives blood from the body, comes in, and it contracts. It moves the blood through the lungs. From the lungs, goes out to that pulmonary artery. Oxygen, carbon dioxide exchange takes place. From the lungs, the body returns to the left side of our heart, right up in here, where it moves through the body to contract out that left side. So the surface of the heart has coronary arteries, blood vessels that carry oxygen-rich blood to the heart's muscle itself. If the circulation to the heart muscle is diminished, that's when the patient is going to experience chest pain. So if they have maybe like a little blockage in here somewhere and that muscle is not getting the blood that it needs, it's going to start to hurt. So we have big veins and arteries going on in here. So we have our aorta, which is this big artery right here. This is called the aortic arch as it comes around. This is what's pumping up to your neck veins right here. This down here to the body, this is our artery, that our descending artery. So like this would be your abdominal aorta going down, and then it would separate into your femoral. And then this is our big veins coming back. This is from the body, and this is from the body. So our veins coming back in, and the arteries are pumping it out. Superior vena cava, so it's the top vein. Inferior vena cava is our big bottom vein. And as we'll talk more about the heart when we get into cardiovascular, but in general terms, we have our right atria. This is right here, and we have other stuff going on in here as well. But right atrium going here, left atrium right in here. You have your right ventricle right here, and our left ventricle on this side right here. The apex is the bottom of the heart, which is the opposite from the lungs, and I get that that's weird, but that's the bottom of your heart. You have your aortic valve right in here. So you have your mitral bicuspid valve right in here. And then your tricuspid valve is over in here. And we'll talk about those more when we get to cardiac, respiratory emergencies, that type of stuff. So again, your heart muscle in general is called the myocardium. So if somebody has a heart attack, they have a myocardial infarction, is affecting the myocardium, which is the heart muscle. So we have blood vessels, and these are responsible for transporting blood through our body. We have arteries. These carry blood away from the heart and have a thick muscular wall that allows them to constrict and dilate in response to the body's circulation needs. We have arterioles. So think of like a big artery. As they get smaller, they turn into arterioles. As they reach the tissue, they become smaller. And at the end of the arterioles, these turn into capillaries. These are really thin blood vessels where that exchange of oxygen, nutrients, and waste products is going to take place. When that exchange takes place, they're going to turn into venules, small veins that begin transport of blood back to the heart. And eventually those little small venules turn into our veins that you can see in your hands. Those are just larger vessels that are responsible for transporting the blood back to our heart. Most arteries carry oxygenated blood with the exception of our coronary arteries, so the ones that are in our heart. And most veins carry deoxygenated blood with the exception of our pulmonary veins, which are in our lungs. They kind of do the opposite. We have blood. Obviously, you guys have seen your own blood, probably other people's blood. But blood is made up of several components. Each of those has a specific role. There's plasma. This is a yellowish liquid in which the blood cells are suspended. We have some formed elements, red blood cells. These carry oxygen to the cells. We have our white blood cells. These help us fight infection. And then we have platelets, which are responsible for clotting of the blood. So if you cut yourself and it bleeds a little bit and it starts to clot up, that's the platelets helping you out there. We have our nervous system. So the nervous system receives, interprets, and responds to various stimuli by coordinating the activities of various organ systems. So we have sensory nerves. These receive information from various receptors in the body. We have interpretive nerves. These interpret and analyze the sensory or the sensory input that determine a response. And we have motor nerves. These carry out appropriate responses like contraction of our muscles. The nervous system also contains these, which is the central nervous system. This consists just of our brain and our spinal cord. We have our peripheral nervous system. This consists of all the nerves that transmit muscle or messages to and from the central nervous system, which is our brain and spinal cord. We have a somatic nervous system. This is a voluntary nervous system responsible for our voluntary movements. And we have an automatic nervous system, and these are divided into sympathetic and parasympathetic. It's kind of our fight or flight situation. So it's an involuntary nervous system response. And those two divisions, the sympathetic nervous system is what is exciting our body, and the parasympathetic nervous system is what is slowing our body. We have reflexes, an impulse that travels straight from the body to the spinal cord. Like if you put your hand on the stove and it's hot and it jerks away, that's going to be a reflex. So it's just an automatic impulse that our body does, typically. We have this fun word, which is called the integumentary system, also known as your skin. It's just a really fancy word for skin, hair, and nails. So the integumentary system consists of that, the skin, the hair, and the nails. So the skin provides us a protective barrier from the environment. It's our first line of defense against infection. It helps regulate our body temperature, and it has 3 layers. So it has the epidermis, which is this outermost layer right here. And then our dermis, which is this like kind of top layer right in here. And that's going to be our middle layer. And then we have our subcutaneous layer. This is our innermost layer, kind of where all the fatty stuff is. So our epidermis layer, not much going on up in here. Some of the capillary network a little bit. Our dermis is going to have some of our glands, our shafts of our hair follicles. And then our subcutaneous, this is going to be our fatty tissue, sweat glands, that type of stuff down in there. Our hair helps us with protection and temperature regulation. And then our nails, these just, we don't really need them. They help us manipulate and pick up objects. That's the main function of our nails that we have. So we have our digestive system. So this is responsible for processing food, absorbing nutrients, and eliminating waste. So this kind of starts up on top with our upper and lower airways. We have our tongue, teeth, sublingual gland up in here, our trachea, pharynx. Your larynx, again, is your voice box down in here. It goes into your esophagus, down into your stomach. You have your spleen right back here, some bile ducts. Your liver is up in here. Your little tiny gallbladder right in here that we don't really need. That is a problem for people. We have our large intestine right here. Pancreas is this little guy right up in here. Duodenum, that's this little area right here at the end of our stomach. There's a little tiny area right there. Your appendix right here in the right lower. Remember, it's right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. We have our small intestine right in here, and then rectum and anus where it all comes out. So the digestive system consists of a long tube called the alimentary canal and accessory organs of digestion. 2 processes of digestion. We have mechanical and chemical. So mechanical is going to be like chewing our food, swallowing, that rhythmic movement of food through the digestive tract called peristalsis, and the elimination of waste or defecation. So we poop it out. Chemically, this is going to include the release of various chemicals throughout our digestive tract. to assist with that breakdown of the material and the absorption of the nutrients from what we're feeding ourselves. Our stomach, once the food is swallowed, it's going to end up in the stomach through our esophagus. Once in the stomach, it's going to be churned up with the digestive chemicals, and then material then moves into our small intestine, where additional chemicals are added and further digestion and absorption can occur. We have our urinary system, so male and female urinary system. Males, you guys have a prostate gland, the urinary bladder, which is up here, and then the urethra that comes down through here. Females, we have our uterus, the vagina right in here, the urinary bladder, and our urethra is a little bit smaller right here. Our kidneys, these are our filters. The ureters, these carry the urine and waste from the kidney to the urinary bladder. And then you have your urinary bladder. This receives urine and waste from the ureters and holds it until it's eliminated. So it's kind of like our container. Then you have your urethra. This is going to carry the urine from our bladder to be eliminated. That's usually if somebody has like a UTI, it's kind of going to start there and work its way all the way up through the kidneys. So those can be a little bit dangerous because of that. We have a lymphatic or immune system. So the lymphatic immune system helps defend the body against infection and disease and returns tissues and fluid back to the bloodstream. If we have an excessive fluid from tissue that's collected in the lymphatic tissue, this is moved through the lymphatic ducts and that's released back into our circulatory system. This is why sometimes people have like edema in their feet, like water weight. The lymph nodes, they filter the fluid where the white cells help defend against that infection. Our tonsils are part of this. This is a pair of lymph nodes in the posterior of our oral cavity. Some people have had these out, some people still have these, so it's always a question we can ask people if they have a sore throat or something like that going on. Our endocrine system, these are all of our hormones and our glands. So our endocrine system help regulate various body systems and processes through the release of hormones into our bloodstream. The endocrine system consists of a number of glands that release chemicals called hormones. Hormones help regulate various body systems and processes, and they affect physical and mental abilities, reproduction, and behavior. So glands of the endocrine system there's a ton of them. There's hypothalamus, the penile, pituitary, thyroid, adrenal, pancreas, ovaries, testes, parathyroid, and thymus glands out there. Male reproductive system is responsible for the development of specialized cells and structures designed to create and protect the fetus until birth. The male and female reproductive systems are very different. So the male reproductive system consists of two testicles that produce sperm, two vas deferens that carry the sperm from the testes. There's an accessory gland and the penis. Females, we have two ovaries that store the ovum, or also known as the eggs. We have two fallopian tubes that carry the ovum to the uterus. The uterus is where the fetus develops, and then the vagina. Okay, a life support chain. So life is dependent upon a consistent chain of events that provides gases and nutrients our bodies need, and we need to eliminate some carbon dioxide and some waste product and that kind of stuff that our body doesn't need. So with this, we have ventilation and respiration. We intake oxygen, we eliminate carbon dioxide. We have perfusion, which is our blood going round and round. That's our transport of the oxygen and carbon dioxide to and from the cells. And then we have cellular respiration, so that oxygen exchange and carbon dioxide exchange is taking place within those cells, within our capillaries, within our alveoli, where all that's taking place. And if this needs to keep going around and round, or we're not going to sustain life very quickly. So there's several factors that can interfere with life support processes, causing a breakdown in the system and resulting in a variety of conditions that people can have. Composition of ambient air, or just our atmospheric air, contains about 21% oxygen. Smoke, other chemicals in the air can decrease that amount. Conditions of the respiratory system. So there has to be an adequate flow of air into and out of the lungs. So if they're having trouble breathing or labored breathing, that's all going to affect this. So the flow can be diminished by any airway obstructions, causing problems of that exchange to take place of our oxygen, carbon dioxide. Conditions of the circulatory system. If the heart does not pump effectively, blood flow is going to diminish. That's our perfusion part. If the amount of blood is diminished, the carrying capacity of that and the nutrients and all that waste is going to be affected. So just the circulatory part of this. And then the condition of tissues and cells. If the tissues and cells are damaged themselves due to something medical or something trauma that patient is going through, that ability to exchange those gases and nutrients is all going to be affected through that. All right, so stop, review, and remember the study of biological function is called physiology. Gas exchange in the respiratory system is going to occur in our alveoli. So we have the bronchioles, which are the bigger in our lungs. So we have the trachea, which goes down into the bronchioles, which goes into the alveoli, the little tiny sacs at the distal, the furthest end of our bronchioles. The brain and spinal cord are all part of the central nervous system. Okay, I'm going to stop share. How are we doing? Everybody hanging with me? Okay. Okay. All right. Do we need to take a quick fiver? No, keep going. Keep going? Okay. You guys are like, yeah, it's not even 6 o'clock yet. Let's keep going. We get done earlier. All right. I'm going to share my screen one more time, and we're going to do chapter 6, which is lifespan development. All right, so this chapter is going to be talking about the different age brackets. So we have infancy, toddler, preschool age, school age, adolescent, early adulthood, middle adulthood, and late adulthood. So we're going to follow this girl called Jamie as she goes through life here. So it's going to kind of look at the physiological and psychosocial changes that occur from birth to death. So we're going to follow Jamie's developments as she goes through her different stages of life here. So we have infancy. This is birth to age 1. So this is our little girl here, Jamie. There's a lot of changes that occur in that first year of life. Infants are totally dependent upon others, but begin to walk and develop their own personalities. Saying pediatric patients are not little adults is not always true. However, we're keeping in mind that there are some anatomical and psychosocial differences between the infant age group and everybody else. The differences in anatomy and the airway pose potential challenges and require significant alterations in treatment. And then we're going to understand some basic reflexes that these little ones go through. Physiologically, at birth, they weigh between 6.6 and 7.7 pounds on average. Their weight's going to double by 6 months and triple by 12 months. Their head is huge. It's 25% of their body weight. They grow older. Their pulse and respiratory rate are going to decrease, and their blood pressure is going to increase. Their airway is shorter. It's narrower and less stable, and it's more easily obstructed than any other stage of life. That's why babies are always choking on stuff. They're primarily nose breathers until at least 4 weeks of age, and nasal congestion can cause difficulty breathing in this age bracket. They're also diaphragm breathers, so we may notice more movement around the abdominal area than the chest area when they breathe. While they're in the mother's uterus, antibodies are passed to them from the mother, and as she breastfeeds, they're going to continue to get those antibodies. They have reflexes. So the moral reflex, this is when they're startled, they throw their arms out and spread their fingers out and grab with their fingers in their arms. That's the moral reflex. You have the palmar reflex. This is when something's placed in their palm, they grab it. Within the first few months, they start to kind of release it as they're grasping objects. The rooting reflex, this is if you touch their cheek, they're hungry, they're going to turn their head to that side. The sucking reflex is when you stroke their lips, they start sucking. That's in conjunction with their rooting reflex, just means that they're hungry. They're going to sleep about 16 to 18 hours through the day and night. It's going to change to 4 to 6 hours during the day, and 9 to 10 hours at night. Infants usually sleep through the night at about 2 to 4 months. Their extremities grow in a length from combination of growth plates at the end of each long bone and the epiphyseal plates near the end of the long bones. They have the soft spots on their head. We have two of those because the bones aren't fused together totally. Those are called fontanelles. And then there's one anterior and one posterior, so one in front and one in back. If we look at the anterior fontanelle or the one that's in front, we can get a general idea of hydration. If it's sunken in, they're dehydrated. It's normally just slightly below the bone, the skull, the bones of the skull. Psychosocially, while an infant, Jamie's primary means of communication is crying. Cries when they're hungry, when they're tired, when they need to be changed, and so on. When the first 6 months, they begin to display bonding, which is their sense that their needs are being met, they're being fed, they're being changed. Trust versus mistrust. They like an orderly, predictable environment. That's why they say babies like to be on a schedule. When their environment is disorderly and irregular, they start to develop anxiety and insecurity over that. Scaffolding, this is just learning and building on what they've already learned. And then their temperament, this is just their reaction to that environment that they're in. And we have toddlers. I'm sure some of you guys have these age brackets at home. This is 12 to 36 months. Physiologically, as a toddler, body temperature ranges from 96.8 to 99.6 degrees Fahrenheit. They gain about 4.4 pounds per year. They develop and improve fine motor skills, the use of their hands, fingers to grasp and manipulate objects. They start to get their primary teeth in, and they're physiologically capable of being toilet trained by the age of 12 to 15 months, but not psychologically ready usually until about 18 to 30 months of age, with the average age of toilet training being 28 months. Then I put in the outline that you guys have the basic vitals that you would see in these different age brackets. Psychosocially, this is where cognitive development kind of starts to begin, developing the knowledge and thinking. They look at the cognitive development that they're going to develop as a toddler. So that's kind of this age bracket right there. We have preschool age. This is 3 to 5. So in this age bracket, they're going to continue to develop and refine their body systems physiologically. Psychosocially, this is where they're learning new skills. They're comparing themselves to others. Maybe they're starting kindergarten or preschool. They're starting to be feeling like they're part of a group. That's the major things going on in the 3 to 5 age bracket. We have our 6 to 12-year-olds. This is our school age. Psychosocially, for this age bracket, their body temperature is going to be like the 98.6 degrees Fahrenheit. They're going to gain about 6.6 pounds a year. They grow about 2.4 inches a year. They're going to start to lose those primary or their baby teeth, and they're going to be replaced with their permanent teeth. Psychosocially, this is a transition time for both the kids and the parents. Parents have to spend less time with them and provide a more general supervision because they're at school. They're going to develop better decision-making skills on their own. Self-esteem is going to be developed and strongly affected by popularity with their peers, rejection, emotional support, and neglect. As they mature, moral development begins when they're rewarded for what the parents teach them is right and punished for what they think is wrong. Cognitive growth, moral reasoning appears, and the control of their behavior shifts from external sources to internal self-control in this age bracket. Then we have our adolescents, 13 to 19-year-olds. So with this, or physiologically wise, during adolescence, they're going to have a rapid 2 to 3 year growth spurt, beginning with enlargement of the hands and the feet, then their extremities, and finally the chest and the trunk. As a general rule, girls are usually finished growing by the age of 16, while boys finish at about 18. Both males and females reach reproductive maturity. Secondary development occurs in this age bracket as well. That's physiologically. Psychosocially, this is a tough age for people. It can be a time for serious family conflict. Adolescents strive for independence, and parents are striving for control over them. The kids are trying to achieve more independence and develop their own identities. Body image is a huge concern in this age bracket. Eating disorders are common in this age bracket. This is the time a lot of the self-destructive behavior begins, use of tobacco and alcohol, illicit drugs, unsafe driving. Depression and suicide are more prevalent in this age bracket than any other age bracket. As an adolescent, develop their capacity for logical, analytical, and abstract thinking. They begin to start to develop their own personal code of ethics as well. So a lot going on in that age bracket. Early adulthood, I'm just realizing to myself now I'm not here anymore. This is 20 to 40 years old. So this is our physiological for the early adulthood. They're going to start to develop lifelong habits and routines. Now you went to college, now you have your career, you got your job. Peak physical condition is between 19 and 26. All body systems are performing at optimal levels. After the end of this period, our body is going to start the slowing process, which is always fun to talk about. Psychosocial wise, this is the highest level of job stress occurring in early adulthood, establishing our new identity. Childbirth is common in this age bracket. With children comes additional stresses and additional challenges. So 20 to 40, a lot going on there. Middle adulthood, who's with me here? This is where I'm stuck in right now. So physiologically, there's not a lot of significant changes in vital signs for this. To early middle adulthood, we're starting to have some vision problems, maybe need some glasses, maybe some bifocals. We're becoming concerned about our health. Heart disease is a major killer after the age of 40. Weight control becomes more difficult in this age bracket. So physiologically, we're not starting to fall apart yet, but we're starting to try to fall apart a little bit. Psychosocially, we're going to become more task orientated as we see time for accomplishing lifelong goals start to diminish. We want to do more things. We tend to approach problems more as challenges than threats. If we have children, they're starting their own lives now where they're experiencing the empty nest syndrome. This is the time maybe they're going to increase freedom and opportunity to then have some self-fulfillment, maybe do something they hadn't done before they had kids. Not only are they concerned about their children, but they're also concerned about their aging parents in this age bracket. So quite a bit going on there. And we have late adulthood. This is 61 years or older. So physiologically, vital signs are going to depend upon health. Cardiovascular systems become less efficient. Our blood volume decreases. Respiratory systems start to deteriorate, making respiratory disorders more common, like pneumonia. Changes in our endocrine system are going to result in a decreased metabolism. And then our body systems just start to deteriorate as time goes on. We're kind of meant to be here for, not 200 years. So things start to just kind of slow as we get older. Psychosocially, they're going to face a lot of challenges during this age bracket as motivation, personal interests, and activities. Those kind of things can enhance this later time in life. The living environment that they're in, how long can they live at home? They're worried about this stuff. Do they have to go to a nursing home or assisted living? Self-worth, they're kind of concerned with their productivity, quality of the benefits of themselves. They had this job, this long career, retired, they're not doing anything. They're not feeling like they're doing anything. They have some financial burdens. They have limited income or expenses. They have fixed incomes that they're living on. Everything's getting more expensive. So financial concerns start to weigh heavy on some of the decisions that they're making. And maybe they can't do this medication. They can do this one. Or maybe they have decisions that they need to make. Death and dying, they start to see their friends and their relatives become ill and die. And then concerns of their own health conditions and mortality start to kind of come to mind as well. All right, so with this one, we have over a person's lifetime, our heart rate is going to decrease. Our respiratory rate is going to decrease. And our blood pressure is just going to start to increase. So it's going to be this one, decrease, decrease, increase. We're born with a rapid heart rate and a rapid respiratory rate and a low blood pressure, and everything's going to flip-flop as we get older. At what age does the individual form peer groups? We say preschooler age, they start to form those peer groups. And then last question, normal blood pressure in an adolescent, which is on the outline that I gave you guys. So it's going to be 80 to 120 as a normal blood pressure for adolescents. But we can have you guys, that's your homework, is look at the vital signs that are on that outline. All right, stop screen share. How are you feeling about this so far? I'm not like flying through this too fast on you guys. Feel free to take your thing off and chat. We are done with the lecture part, so all 3 chapters are pretty short tonight. Feeling good?
Okay. Yeah, I'm good.
Okay. Jan feels good. Kevin's feeling good. All right. I'm going to stop recording just so you guys aren't answering questions and